Hi, I'm Naturopathic Dr. Lauren DeVille, and you are watching a series on identifying and removing the obstacles to cure and giving your body the building blocks that it needs in order to heal itself. So today's episode is on the obstacle mental emotional toxins and specifically depression. So if I have a patient that has any form of mental emotional illness, I ask myself and I potentially ask them one of four questions. Is it a problem in the hormone balancing? Is it a problem in neurotransmitters? Is it a problem in their thinking? Or is it a problem in their circumstances? And this requires a conversation for sure in order to identify it. So if there's a family history of depression, then most likely the neurotransmitters are playing a role. So at that point, I will begin to do one of two things. Depending on whether they're already on medication, I will do neurotransmitter testing, which is a urine test, in order to see in the moment, snapshot, what's high and what's low. And I'll also potentially do some genetic testing in order to figure out which of the enzymes that help to break down the catecholamines and the serotonin and just amines, which are a lot of the neurotransmitters that are associated with all of this, to see where the mutations might be that might be contributing to this, so that we can kind of balance the enzyme's ability to get things balanced as much as possible. If it showed up either during, like say for a woman in perimenopause or postmenopause, or if it's a woman that typically ends up feeling really a depth of despair around her period, that's the point at which I'm saying, okay, this is probably hormonal. That's not the only case. That would be hormonal in terms of your the sex hormones specifically. And for a man, low testosterone can also do this. But there's other hormones that can do this too. I've certainly seen thyroid contribute quite a bit to this. I've seen your adrenal function contribute quite a bit. If your adrenal function is super low because you just can't handle any more stress, then that certainly is going to contribute to the depression as well. So if I hear that the depression began during a time of high stress, I start thinking adrenals and possibly thyroid. A lot of times those things go together. So there's lots of clues based on the story that you've got going on. If everything else is looking like it's going pretty well, but you are stuck in a cycle of negative thinking, and I hear that, where everything tends to spin to the negative, but everything else is looking fine, that's the point at which I start thinking, okay, do I need to refer for cognitive behavioral therapy or something like that, that really retrains you how to listen to and tune into your thoughts. So we certainly do have the ability to take our thoughts captive, but it becomes a whole lot harder if you also have imbalances in the hormones and in the neurotransmitters. So all of these things have to work together. And then the circumstances. So remember that mental emotional symptoms are symptoms like everything else. Your body's smart. It is giving you the symptom that you have in order to tell you that there's a problem. It's there to lead you to the problem. So if the problem is not in your actual architecture, in your neurotransmitters and your hormones, and if it's not in your mind, if it's not the way that you're thinking, maybe it's external to you. Maybe there's something that is going on in your life that shouldn't be, and you need to actually make a change. And your depression is telling you that something is off, and you need to change your life circumstances in some way. You need to make sure you listen to that, and that's why you have to have that full picture to make sure that you're not just doubling down on the positive thinking when what you really need to do is change the environment that you're in, potentially. So those are the four main questions. So if you are struggling with depression, make sure that you and your naturopath and your therapist kind of are all on board with identifying which of these four or which combination of these four are an issue. So again, the questions are, is the issue with your hormones? Is the issue with your neurotransmitters? Is the issue with your thinking? Or is the issue with your circumstances? All right, so thanks for joining me, and I'll see you in the next video.